When the terms birth control or family planning is mentioned, it's always a question of what the woman can do, whether it's having an IUD inserted into her or taking contraception. The responsibility of birth control and family planning seems to rest largely on the woman. But with vasectomy gaining popularity amongst men, it seems all that is bound to change. A vasectomy is a surgical procedure for male sterilization or permanent contraception. During the procedure, the male vasa differential are cut, tied or sealed so as to prevent sperm from entering into the urethra, preventing fertilization of the females through sexual intercourse. There are two types of vasectomy, which are conventional vasectomy, which involves doctor making two small cuts in your scrotum that are stitched up with light stitches at the end of the procedure. The stitch over a short period of time dissolves into the skin. For the conventional vasectomy, the doctor makes a cut into your scrotum to reach two tubes. Each of these tubes is called a vas deferens, and there's one for each of the testicles. When each vas deferens has been cut, sperm will no longer be able to reach your semen. The second form of vasectomy, the non-scalpel, is a newer and commonly used method that negates the need of a scalpel to cut your skin. The doctor feels for each vas deferens under your scrotum and uses the clamp to hold them together. My parents will be so proud watching this, especially my mom, because that's what every African parent's dream, to see their daughter on TV talking about scrotum, sperm, and semen. Mama, I made it! The good thing about this procedure is that you wouldn't need stitches, unlike the conventional vasectomy, where you get stitches, which with time will dissolve. One would think that a surgery so delicate would take time and would be so difficult to perform. But the truth about a vasectomy is that it's a simple procedure that can be done within 30 minutes. In fact, the procedure is so non-invasive that you can have the procedure and be back at work within a week. Vasectomies are almost 100% effective. However, as simple and minimally invasive vasectomies are almost permanent, as it is not easily reversed. It is for this reason that young childless men are usually advised against the procedure, as their chances of being fathers after the procedure is at 0%, which goes to state the efficacy of the vasectomy. A reverse procedure isn't entirely ruled out, but the procedure is very expensive and often doesn't restore the male sperm count. This is important as it is being reported that 90% of men are satisfied with their decision of getting a vasectomy, while 7 to 10% of men regret their decision. Men who were in relationships where both partners agreed on getting the procedure done were less regretful. However, younger men, especially men in their 20s, were always at the risk of regretting their decision and seeking for a reversal procedure. A study showed men in their 20s were 12.5 times more likely to undergo a vasectomy reversal later on in life. It is for reasons like this, pre-vasectomy counseling is very important, especially in younger men. So this is how it works after having a vasectomy. The testes remain in the scrotum, where Leydig cells continue to produce testosterone and other male hormones that continue to be secreted into the bloodstream. So you're probably thinking, what does this mean for sperm production? Does the body still produce sperm? Sperm is still produced by the testicles, but is broken down and absorbed by the body. A lot of fluid content is absorbed by membranes in the epididymis. Sperm is matured in the epididymis for about a month before leaving the testicles. Now, it's still not certain, but there are studies that suggest sexual desires may be reduced after having a vasectomy. Now, with most things, there are side effects, which are not too common as the procedure is very safe. Possible side effects are inflammation, swelling, bruising, and infection. They are most times not serious, but if you notice them, please make sure to inform your doctor. A 2012 study demonstrated an infection rate of 2.5% post-vasectomy. In 2014, the AUA reaffirmed that vasectomy is not a risk factor for prostate cancer and stated that it is not necessary for physicians to discuss prostate cancer with their patients prior to carrying out a vasectomy as part of their preoperative counseling. Also, there was a 2017 meta-analysis that found no statistically significant increase in risk of prostate cancer. However, in 2020, a meta-analysis found that a vasectomy increased the incidence of prostate cancer by 9%. Vasectomies are safe, and most patients go on to lead normal lives, free from any pain or discomfort in their scrotum. However, a report by the American Urology Association's vasectomy guidelines found a rate of 14.7% onset scrotal pain, with 0.9% describing the pain as severe. The pain can be constant or periodic, occurring during sex, ejaculation, or physical exertion. For those of you who want to get back into having sex after having a vasectomy, you are advised to give it a few days to heal. Then your doctor will carry out a test that shows your semen is free from sperm. It is important to note that a vasectomy protects you from pregnancies alone and doesn't protect you from STDs. So you still need to practice safe sex by wearing a condom. And if you decide not to be sure, please make sure that you and your partner test regularly for STDs. For more information on sexual and reproductive health, please log on to www.lovematters.ng. You can also call Matters Nigeria for free on 0800 002252. Yes, all calls are absolutely free. Reach us via text or WhatsApp on 090 800 22252. Please follow us on all our social media platforms listed below on your screen. Until next time, peace.